It's been 5 days since Hope Konsole buried her uncle who died of COVID-19. She has decided to go to a health center in Kinyinya sector, Gasawa district, to take a test for COVID-19. Although her test came out negative, she says she had developed some signs of COVID-19. The reason I came to test for COVID-19 is because I had a headache, stomach cramps, and a severe backache. Another reason I came was because of the 3 kids whom I live with. They were infected, but have currently recovered. But the actual reason was because recently on the 7th February, we buried my uncle who died of COVID-19 virus. Before he passed away, he had downplayed all the signs. He used to drive trucks from Tanzania to Rwanda. Since the burial, I didn't get the chance to test for COVID-19, even though other family members had gone for testing. Iragena Florentine, health practitioner, says COVID-19 virus shares similar symptoms with malaria, which may be confusing to many people. I heard that once one gets infected with COVID-19 virus, they develop fever similar to malaria's, along with the body temperature and a headache. On one hand, COVID-19 comes with flu, cough, and chest pains. The director of Kinyinya Health Center, Bernadette, says among those that show signs of COVID-19 virus, 50% of them are infected. Here, when a patient arrives, we direct them to a room where we perform tests, and then we treat them depending on the symptoms that they have. We first perform tests for other diseases, then once we discover it's malaria, we then test them for COVID-19 virus. Depending on some of the signs we encounter, which include cough, fever, and dizziness, you'll find that 50% of them are infected. Doctors say a person can suffer from both malaria and COVID-19 virus at the same time, or even confuse one to be the other. On one hand, once one delays to get treatment for COVID-19 virus, it could lead to extreme effects. One of the members in the COVID-19 task force, Dr. Menilas Nyashimana, urges people to take tests for all diseases once they develop any sicknesses.
Currently, once a person has fever and headache, we do both tests for malaria and COVID-19 virus because it is possible to have both. It's important not to be late for treatment of any disease because the treatments aren't the same. When a person has malaria and receives treatment for malaria only to come back after 3 or 5 days saying they are still ill, then we find COVID-19 virus as well. In that case, when treatment is delayed, the effects are massive and sometimes results to death, as we've witnessed for some, which is why we advise all people to get tests for both.
During this rainy season, malaria cases are expected. The health institutions are informing all healthcare workers and patients that COVID-19 virus and malaria symptoms share some similarities, hence both must be treated at the same time. Mutoni reporting for RwandaTV.